Labor and the Ministry of Health. According to Bernard, the eviction is one of the many strategies that are being put in place to address the rodent infestation.
We had a discussion and we looked at what was happening even after we had renovated the food storeroom. We have this incident now, and we realized that we need to go to the limit, so to speak, no? And we knew that the fact that the vendors, they don't have the adequate facilities, scraps of food that are left outside, we knew that it would provide food for rodents, no? And we felt that we really had to ask them to leave the compound until we have this situation under control, and in the future have a better facility for them.
Okay, now, sir, we understand that this is only one of several strategies that you guys are putting in place?
Mm-hmm. Yes, we are doing several things. Number one, we're identifying areas where rodents are gaining access to the building. As I mentioned before, it's an old building, it's on the ground level. Rodents don't have to climb too much to get in, and so we also noticed that there were some drains that lead from inside the building, no, to facilitate like the removal of wastewater when you're washing, and so we're identifying those and blocking those off so that rodents cannot enter into the building. We have the rodent control program, the poisoning program ongoing. As you realize that the hospital is kind of sensitive, we cannot be throwing poison all over the place, so we started outside, and then I will use traps and different things on the inside, no? Part of the really ongoing thing that we'll be doing is that the public health inspectors will be at least twice a week looking at the hospital, making sure that the garbage is properly removed, that no food is left overnight in the place, that the kitchen is properly maintained. Any sign of rodents, then we will know that something is happening. So we'll be doing a thorough inspection at least twice or more per week at the hospital. We're asking all members of staff to be on guard if they notice anything, to let us know so we can investigate further. No?
Sir, the vendors feel like they weren't notified adequately of their removal from the compound. Any comments to that?
I remember that we had a discussion with them about probably like 2 months ago, and we didn't tell them that we're going to move off the compound, but we hinted to them, I personally hinted to them that the facilities that they have is not adequate, and just be prepared for whatever might happen in the future. The fact that this rodent problem happened and prompted us to take some rather drastic action. No? We realize that it's hard for people, you know, we're trying to make a living. The hospital do need people who can provide food and stuff like that, but we need to get this thing under control. And the last thing we want to hear is that these incidents repeated, and then people are going to say, well, you have the vendors there, they're not adequate, there's scraps of food available, so you're not doing enough to kind of get this under control. No? So it's rather unfortunate, and yes, it's not something that we were happy to do, but we felt that in the best interest to protect the public, to protect the patients at the hospital there.
After the break, CW throws its